I'm not worried about my hospital. I'm not worried about our ability to take care of patients. I'm extremely proud of the people here and the work that we do. What I am worried about is that all of our friends that live out in the community are treating this as no big deal. That's what I really worry about, and that's what really concerns me literally every night. You know, um, I go to Kroger to get some eggs, and I promise you there's not 1 in 10 wearing a mask. You know, um, I go out with my kids to ride bikes or whatever it is. We walk a lot. Obviously now that's what a lot of people are doing because there's nothing else to do. But I promise you, there's not 1 in 10 on the streets, wearing masks. I still see people hugging each other and all those kind of things. And I don't know how to get that word out there. I don't know how to get people convinced that this is a real problem. But what I can say is this, we're sitting here right now in a hospital talking about not taking care of some people so that we have room to take care of these people. I mean, I'm not an old guy. I consider myself a young guy. I've been doing this for over, 20, 25 years. We've never had that conversation. Not in any of the health systems I've worked in. We've never had the conversation of, oh, well, we're going to consider not taking care of these people because they're not as sick, and we're going to take care of these instead. Like, I've never had to have that conversation. And if maybe your readers or your listeners could understand that is the antithesis of any doctor or nurse's oath to take care of people. That is against everything that we hold sacred as for our profession, is to have to choose between who we take care of. And we're actually having those conversations. This is for real. And for anyone to not believe that this is happening, I don't know what else there is to say. I really don't. My worry is that people pay so little attention to it that the cases blow by even what we're prepared for, which as those numbers I gave you, I can expand 50% to 100% more than I already am at. But at some point, we're all going to run out of room. It's not just my hospital; it's everyone's hospital. So that's really the message that has to get out there. Is folks have got to help us out, And this is the other thing too. Ironically, everyone used to think, the way to help is to give food, or whatever. That's not it. It's not it. It's wear your mask and wash your hands. That's really how people can help. So, anyway,